Hi, I'm Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Consultant. A hyperbaric accessory that's proving to be an effective replacement of the ventilator, even without the hyperbaric chamber. It costs fraction of the cost of the ventilator. It is known as the hyperbaric oxygen helmet, and its use is backed by latest award-winning research. This is the topic of my today's video, so let's begin. In Lombardy, Italy, the patients were in critical condition and many of them were dying. The world media focus was on these patients. The newspapers and the reporters were really surprised to see a helmet being used by these patients. Everybody was wearing one. This helmet presumably saved the aerosol of the patient from infecting the people in surrounding, especially the medical personnel and the other patients nearby. This was the first time that people of the world saw in mass numbers the hyperbaric accessory in the action. It was blessing in disguise to have these hyperbaric helmets and to be able to use them when they are manufactured in large numbers. This was one of the novel and first use of a hyperbaric accessory without a hyperbaric chamber. In 2016-17, two doctors in the University of Chicago actually used this, and it's manufactured by an American company known as C-Long Medical Device Company. Dr. Bhakti Patel is an assistant professor of pulmonology in the University of Chicago. She, along with her colleague, Dr. John P. Kress, they were the ones to use the hyperbaric helmet for the use with the ventilator system known as the non-invasive positive ventilation. They pioneered the use of this hyperbaric helmet in the University of Chicago, and they published a study which became very famous and won a lot of awards in 2017. According to their study, the hyperbaric helmet could be attached with the ventilator system as on the right, and also directly with the hospital-based oxygen system. The use of helmet as compared to the mask and the intubation proved to save a lot of lives. The mortality rate and intubation with the mask was only less than 6%, while that with the mask was 53% and more. The helmet proved to be a smash hit with the University of Chicago physicians. And the use of mask and the intubation if was discontinued, there was no use of sedation. If there was no sedation, the chance of survival of the patient increased, and also the weaning of patient after the use of intubation was also reduced, because recovery of the patient who would wear the hyperbaric helmet was far better than that with the mask and the intubation. Up to 86% of patients are dying with the use of ventilator in USA during the COVID-19 pandemic in 2020 in the USA. This is far more than the 53% which was in the original study. 70 to 86% is a huge figure. If the hyperbaric helmet was used, so many lives could have been saved if people have followed the 2017 top 10 researches done by Dr. Bhakti Patel and John P. Chris. There were some Italian doctors in the University of Chicago who actually adopted this idea in the Lombardy, Italy hospital, and the world first time saw these hyperbaric helmets. And now the hyperbaric helmet is known as the bubble helmet, has become world famous. The hyperbaric helmet is non-invasive. It does not require sedation. It does not require any intubation, and it saves so many lives. It is proving to be a revolution in saving the lives in the COVID-19. Another good feature of this helmet is that it avoids cross-infection, because the hood and the bubble-shaped helmet prevents the aerosol of the patient infecting the doctors, nurses, and the nearby patients, because it remains inside the hyperbaric helmet, which is a big advantage, because from the masks there is a lot of leaking of the aerosol with the infected virus particles that can infect the hospital staff, the doctors, the nurses, and the nearby patients. And the hyperbaric helmet proved to be a blessing in disguise. Comparing the statistics and the procedures of America with Italy, it was found that the doctors committed a lot of mistakes in America. Although hyperbaric helmet was invention of USA, the Italians' use of helmet saved so many lives, while the Americans, they were almost losing 86% of their patients on the ventilators. This promoted a lot of doctors to come on social media and beg for changing the protocols of treatment on the ventilators, as even the ventilator would not guarantee the saving of life, because a ventilator is a normobaric oxygenation system which works at the sea level. The hyperbaric chamber actually works in the hyperbaric environment, that is more than the sea level, and is far better. And the hyperbaric helmet is just like the ventilator if it is used outside the hyperbaric chamber. Outside, this hyperbaric helmet is a revolution, because it does not require any electricity, and it does not require any backup generator as well, which would be required for the ventilators. This hyperbaric chamber and this hyperbaric helmet both are fighting on the front lines of the COVID-19 pandemic. The hyperbaric helmet is now in demand from all over the world. Everybody wants to have this hyperbaric helmet before, which were used inside the hyperbaric chamber, would be required only in small quantities, but now the demand has surged for thousands and hundreds of thousands to be required all over the world. Even the manufacturers which are in USA are finding it difficult to keep up with the demand of just the United States of America. Dr. Bhakti Patel, who is of Indian origin and assistant professor of respiratory medicine or pulmonologist, along with her mentor Dr. John P. Chris, successfully demonstrated the utility of the hyperbaric helmet when attached with the ventilator and also when not attached with the ventilator. Nowadays, it is used in University of Pennsylvania, University of Chicago, and in Michigan General Hospital. There are 3 manufacturers in the world who makes these helmets. One is the Ceylon in United States of America, whose helmet was used in the Dr. Bhakti Patel's study. The second is StarMed, which is manufactured outside the United States of America, and the third is Amron. These 3 manufacturers can't keep up with the demand currently. Ceylon is a family-owned business. The owner is Chris Austin and his family, who are struggling to keep up with the demand. Before, they would get orders for maybe a dozen or 2 dozen. Now everybody wants at least 20,000 from a country to maybe thousands in a day from United States. They have not raised the price of these helmets, and to keep up with the demand, they wanted the donations from the people, and a lot of people from the church came to their help as a labor. So Virgin Galactic donated some money to them to get some extra machinery to accomplish the high demand. As you can see, the helmet has a plastic hood and an aluminum ring at the neck, which would be attached to a silicone seal that actually forms a seal with the circumference of the neck. And there is a actually attachment of 2 pipes, one coming in and one going out. The coming in is for the inspiratory side and the going out is for the expiratory side. The helmet, which cost only $200, can be a replacement for a ventilator which cost $100,000 each at least, or maybe more. The hyperbaric helmet, while being used inside the hyperbaric chamber, was useful in preventing the spread of infection, and it is proving to be effective in spread of infection even outside of it because of the transparent bubble shaped hood. And this is the feature which is very valuable in the COVID-19 disease. Mr. Chris Austin has now increased his production to 1,000 units a day with the help of volunteers and the charity money he got. The other company, which is called the intersurgical company makes the second helmet known as StarMat. Or this Caster StarMat helmet. Italy also manufactures its own helmets, but they can't be exported outside because of the demand from Italy. And same is the case maybe now in the USA with so many COVID positive cases needing ICU care. The export of these helmets out of United States would be difficult. The StarMat helmets is a bit different in design, that it has a rounded valve, bidirectional, which opens up when the inside pressure of the helmet drops to almost zero, so that asphyxiation is avoided, which is a useful feature. The same valve also serves as a opening for the feeding tube. If the patient has to be fed, the feeding tube goes to his mouth. And also it can be opened up from the outside to help the patient if need arises. The helmet is available in many sizes depending on the size of head of the patient, and the size of the neck or the circumference determines how the silicone seal would be cut, which is actually marked, and you can cut the size according to the circumference of the neck and then apply the seal, and then the glass bubble or the plastic bubble is fitted on top of it by attaching the glass or the plastic part with the rounded aluminum ring. Amron is the third company in United States of America that makes this hyperbaric helmet, which is a bit simpler in design as compared to the other two. This clear plastic bubble helmet allows for easy reading of the book or watching the television, and is far more comfortable than the mask system, which can produce bruises while the person wears it for more than 8 hours. The helmet is comfortable and does not produce any bruises. The silicone base of the neck is autoclavable in some models and can be reused. In COVID-19, these helmets can be used and disposed, providing it to be very valuable in spreading of infection. While the mask system and the intubation exposes the health professionals to the infection, because the bronchi of the patient contains a lot of viruses which could infect professional, and that is the reason so many doctors and nurses have been infected. Please subscribe to my channel by pressing the subscribe button, and also don't forget to press the bell icon to encourage our hard work and to see the highly informative videos about hyperbaric medicine. If you have any questions regarding the hyperbaric medicine, you can contact me via the apps scrolling down below. I hope to see you soon on the next video. So for now, bye and take care.